Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before collecting and testing a stool specimen, check the care plan or the nurse's instructions. Note any restrictions or special considerations. Before you begin, practice hand hygiene and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program.
Hi, sir. My name is Ken, and I'm going to be your nursing assistant today. If you could please just go ahead and verify your name and date of birth for me, please.
It's Ethan White and 10/4/62.
When preparing to collect and test a stool specimen, identify the patient and label the specimen container in the person's presence.
All right, sir, and I'm just going to go ahead and raise your head up and put you in a more comfortable position, okay?
Then, while wearing gloves, ask the person to void. If he doesn't use the bathroom, put a waterproof pad under him if one is not already in place, and provide the voiding device. When the person is done with the urinal, empty, rinse, clean, disinfect, and dry the device. Return with the clean urinal. Then provide the bedpan or commode to collect the stool. If the person will use the bathroom, put the specimen pan on the toilet at the back of the seat. Remind the person to use the call light when she is finished.
Okay, and just call me or pull the red cord when you're done.
Okay.
Ask the person not to put toilet tissue into the bedpan, commode, or specimen pan.
So I've got some toilet paper here for you, but it's very important that when you clean yourself up, you don't discard the toilet paper inside the bedpan because we can't have any contamination.
If he's using the bedpan or commode, provide a bag for toilet tissue. Then remove and discard your gloves and practice hand hygiene. Make sure toilet tissue is within the person's reach. Also, place the call light within reach. Raise or lower the bed rails following the care plan.
And while I'm gone, your call light's going to be right here, so you're just going to go ahead and call us whenever you're done so we can go ahead and collect the specimen, okay?
If the person can be left alone, leave the room. Return to the room when the person signals, or every 5 minutes to check on the person. Always knock before entering. After you return to the room, practice hand hygiene and put on gloves. If the bed rail is up, lower it. Remove the bedpan and the bag with waste tissue.
Okay, sir, I'm going to go ahead and take your waste here and put it right there.
Okay, now that you're done,
Alternatively, if the person used the toilet or commode, assist her off it. For any person, observe the stool's color, amount, consistency, and odor. After putting on clean gloves, assist the person with hand hygiene and perform perineal care if needed, as shown in the video skills giving male perineal care or giving female perineal care. Now collect the specimen. Using a tongue blade, take about 2 tablespoons from the middle of the formed stool. And put it in the specimen container. Include any pus, mucus, or blood that's in the stool. If required by agency policy, take specimens from 2 different places in the stool. After wrapping the tongue blade in toilet tissue, discard it in the disposable bag. Then put the lid on the specimen container and place the container in the plastic bag. Don't let it touch the outside of the bag. Apply a biohazard label or additional identification documentation according to agency policy. Remove and discard your gloves and practice hand hygiene. After putting on clean disposable gloves, test the specimen if ordered. To do this, prepare your supplies and open the test kit. Then use a tongue blade to obtain a small amount of stool. Apply a thin smear of stool on box A on the test paper. Using another tongue blade, obtain a small amount from another part of the stool. Apply a thin smear of stool on box B on the test paper. Close the packet. Wrap the tongue blades in toilet tissue and discard them. Turn the packet over. On this side, open the flap. Apply developer from the kit to boxes A and B, following the manufacturer's instructions. After waiting 10 to 60 seconds, as required by the manufacturer, note the color changes on your assignment sheet and dispose of the test packet. For complete information on what observations to report and record, see the section on delegation in this program. Now empty, rinse, clean, disinfect, and dry the equipment. When you're done, return the equipment to its proper place. Then remove your gloves and perform hand hygiene. After collecting and testing a stool specimen, perform post-procedure care. For example, put on clean gloves and take the specimen and requisition slip to the laboratory or storage area per facility policy. For detailed information, see the section on follow-up care, reporting, and recording in this program.